Anyway, so the question is, we are here at Himson, and obviously we had one of the co-founders from Twitter in a keynote the other day, and it's funny that they put us here in a corner here, which I love very much because of the light. But I think there's a bigger audience out there who needs to understand the power of social media, and it seems like they're not right here in at least this corner of the building. The question though is, how can we use social media for better outcomes? In other words, how can we use social media so we can influence the quality of the user experience and also improve the quality of life? So that's the question.
Was anybody at the CIO forum on Monday? Okay, the Seattle Mama Doc.
Yeah.
Did you see that presentation?
I hope that's going to be available online at some point.
Yeah,
I know that was recorded, but oh man, it was incredible.
I think she's doing it too. Yeah, she is.
And she'll be at the Cerner booth tomorrow. So Seattle Mama Doc is her Twitter handle. Her name is Wendy Sue Swanson. She's a pediatrician in Seattle that just really does some amazing blogging. I mean, she's active on Twitter.
But she also uses it to engage her patient and the parents of her patients to get out correct health information. Particularly, she gave the example of when Jenny McCarthy went on Oprah a couple of years ago with her anti-vaccine campaign. All of a sudden, all of the parents of infants started asking her, well, should I do this? So she got she was answering the question so many times that she put up a video. The hospital she works for, Seattle Children's, gives her own blog that allows her to share things like this as well. She also did the same thing. She's refuted. I got the sense that she's I'm not a big fan of Dr. Oz, who has some interesting theories about healthcare, and she goes out there and tries to set the record straight for the public, but also for her individual patients. And she does so without naming patients, without discussing cases individually, because they need to get into PHI and HIPAA, and that's a whole different ballgame out there that you have to be careful with on social media.
Yesterday we had a great panel with physician bloggers, and you can't give medical advice on Twitter. You don't want to get sued. And so, you have to be very careful engaging patients on social media platforms. Kristen, did you want to respond to him, and John?
Yeah,
and then we got another question behind the curtain.
So, I would echo, Wendy Sue is one of our bright minds, and she has some really strong opinions on how we can maybe think about retooling the system to enable physicians to really use technology and social tools to interact with their patients. Right now there are a lot of things that prohibit that. So how do we look at things a little bit differently to make that more possible, so that it is more amenable to what patients and what each of us really want to have, what kind of connections we really want in managing our own care. I think, and Wendy's joining a panel with one of our physicians and Jamie Haywood from Patients Like Me on a panel at South by Southwest, and it's called a doctor, patient, and an insurer. Kind of walk into a bar, I think it's called, something like that.
And that happens a lot at South by Southwest too.
I'm sure it will the night before that panel. But it's all kidding aside, it's really about bringing those three stakeholders together to understand how do we start coming up with solutions to make real solutions for how we improve health and wellness. How do patients and physicians and insurers come together to change, make some systems changes that enable those connections. And I think one of those ways is through, social health communities, through online health communities that are very targeted to, perhaps groups of like-minded individuals, whether it's around, a chronic disease or a certain category of health. And that's something that we certainly, we already have a number of programs that are built around online communities, and something that we're looking at for a lot of growth in the next in the coming years. But I think that is one piece. But there are a lot of other things that we need to consider, and I think a big part of it is just the social tools are enabling us, and the connections that we're building through the social tools are enabling us to bring those stakeholders together to have those conversations and figure out what those solutions may be.
Sherry, did you have something?
By the way, I just tweeted Seattle Mama Doc's handle up there, so you can check it out. You can so you can find it and link to it, okay?
I think John has one comment.
Okay.
Yeah, so, the idea of what impact do we really have from social media is interesting for me. Last HIMSS, I was going to this new media meetup, and Jim Tate showed up, and we were talking about my blogs and my networking, and he looked at me and he said, John, you have a platform. He's like, and you better use it for good. He said, because I'm going to hold you accountable. And it really hit me because I've always just seen myself as this little guy in Las Vegas, right? That blogs a little and does some stuff on social media. But it's just so interesting to me that a little guy in Las Vegas could have any influence over the industry. But that's probably the most powerful thing about social media is that in aggregate, you can actually flesh out what is the truth, what is the knowledge, and you can share that knowledge and those connections in a way that was never possible before.